Coronavirus is changing the world we live in. We hear in the news about the vulnerability of the elderly, adults with diabetes and autoimmune disease. But there's one group of vulnerable people who've not held the headlines as they should. Children with complex neurodisabilities like cerebral palsy, including the children who come to PACE. Our children are always extremely vulnerable, but their underlying medical and respiratory conditions means contracting COVID-19 could be devastating for them. But not receiving the vital therapy they need to reduce pain and to improve or at least maintain their physical abilities could also have a huge impact on their future. Which is why, despite losing hundreds of thousands of pounds of fundraising income, our specialists are still working as hard as they can to ensure our children get the input they need. But in addition to our support for our children, we need to maintain our support for families. Parents and carers have become 24-hour nurses, physios, occupational and speech and language therapists, teachers and counsellors. The physical and emotional pressures of caring for a child with a complex disability for 24 hours a day weighs heavily on top of concerns for their child's health, which is why our teams are just as critically supporting the well-being of our families too. PACE is committed to continuing our work, but we really need your support urgently before this pandemic changes the face of our services forever. Please, help us to be there for our vulnerable families, today, tomorrow, and for their futures. Visit thepacecentre.org/urgent-appeal and please give whatever you can. Thank you so much.